exercises that might help with a sensation of hip tightness. But first, I think it's important to understand what's happening when you're experiencing hip tightness. Usually people describe hip tightness in the fronts of the thighs. So let's say my hips feel tight. Obviously the hips can refer to any of this region. So while I'm going to focus today on the understanding of the front of the hips and a little bit of the back of the hips, it's important to know that the other things that balance out the structure are the things on the sides of the hips, on the inside and the outside. But the way the hip flexors work, and I hear this mostly from women, though every once in a while I'll have a male client say that he's experiencing hip tightness as well, is there's a lot of muscles that actually flex your hip. The main three are your psoas, which gets a really bad rap. It hangs out really close to your lumbar spine, connects the torso to the lower leg. It's a long muscle, it's meaty, it's filet mignon if you eat meat. That's the psoas muscle. And it provides a lot of stability for the lumbar spine. So yes, it flexes the spine this way, it flexes the hip, can also internally rotate the hip, and it can extend the spine a little bit. So it has a lot of different functions. So that's your psoas. It's really deep. The other two muscles that are heavily involved in hip flexion are your iliacus, which connects your pelvis up here to your thigh, and that basically works to pull your thigh up. And then there's also another muscle called your rectus femoris, which also attaches at the pelvic area in the pelvis and the outside of the knee. And this is a really strong hip flexor when the knee is bent. It flexes the hip. It also extends the knee. It's got a couple of different jobs. And then there's another long muscle called your sartorius that wraps from the pelvis all the way down to the inside of the knee, and that also works as a weak hip flexor. But the understanding of the anatomy, while it's not important, it's just good to know that there's lots of things that do this. And their ability to do this is influenced by how everything else is working above and below it. So just because we're going to focus on minimizing sensation in the fronts of the hips today, and hopefully activating some of the things in the back of the hips, know that whether or not that ability for the sensation to stay is going to be related on how you hold yourself in your everyday life, what position your ribs are in, the strength of some of the surrounding structures. So let's go ahead and get started. I have 3 tools. I have a ball, a block, and a chair. The only one that's really necessary is some sort of block or book. The chair, you'll see, I find really useful for helping to maintain anterior core stability while we're doing some of this stuff. A lot of times what happens is when people go to stretch their hips, they're actually stretching the front of their belly because they go into lumbar extension. So we're going to try and minimize lumbar extension, teach the hip how to extend backwards, and hopefully stretch some of this stuff out. So you're going to take, if you have a block, use the block. The ball isn't necessary, it's a little bit softer. I like the ball for this. Again, you can totally just use a block. You're going to lie on your back. And you're going to think, what in the world does this have to do with the hips? You're going to rest your heels on the chair, if you have one. If not, you can keep your feet flat on the floor with your knees bent. This is a little more effective, but again, not entirely necessary. You're going to very gently press the heels of your feet into the chair. If you've got one, if you don't, just get the sense that your feet are pressing fairly strongly into the ground. You're going to feel your pelvis gently roll. So the tailbone is going to tuck under. Keeping your hands by your sides, take an inhale through your nose, and then exhale out your mouth. Exhale really long, and as you exhale out your mouth, feel the ribs drop down. Keep this sensation of the heels pressing down and that gentle roll of the pelvis. Take an inhale through your nose, exhale out your mouth. Two more breaths there. Inhale, exhale. Last one, inhale, exhale. You shouldn't feel any sensation in your low back. You should feel your hamstrings activating and maybe a little bit your abdominals. From there, move the ball away. If you feel a sensation in your low back, obviously don't do it. You're gonna take the ball away. You're gonna take your yoga block if you've got one, or a thick book. You're gonna slide it right under the sacrum, and if you have a yoga block, you're gonna use the not super wide version. You're gonna use the lowest setting of the yoga block. You're gonna slide it right under your sacrum. And you're simply going to allow gravity to pull everything downward. You're going to breathe here, and as you breathe, just feel the sensation of the inhale, moving down into your belly, moving into your chest, and then your exhale, letting everything relax. So you're trying to release any excess tension that you're holding here, so it'll make it easier to get into the muscles. Breathing in through your nose, and out through your mouth. Seeing if you can make your exhale a little bit longer than your inhale, in through your nose, out through your mouth. Taking 2 more breaths, and as you do this, see if you can notice whether or not your pelvis is level, or if you're more heavy on one side than the other. Just notice that. Last time, inhale, and exhale. Slide the block from out from under there. You're going to come into a kneeling position, and you're going to take your chair if you've got one, or a bench or something you can place your hands on. Again, if you don't have one, not that big a deal, but this will help you maintain the sensation in the right spot. You're going to start with your right foot forward, and you're going to walk your right foot to the right a little bit. So again, we're mainly focusing on the front and the back of the legs today. You can play with different angles and things once you get a sense of opening just in the front and the back. So your right foot is slightly wider than your hip. And you're going to take your left knee, and you're going to move your left knee to the left a little bit, which is going to take your left shin to the right. Weird setup, I know. Now take your hands on your chair, and see if you can make sure that your hips are level and your back is nice and straight. So you're not super lordotic, you're not super rounded, you're just nice and neutral here. You're going to press your hands down. That's going to help you seal the sensation of these lowest ribs staying down. We're actually going to start by keeping the right foot nice and flat on the ground, the big toe engaged, the pinky toe engaged, and the ankle nice and in line with the back of the foot, so the ankle's not collapsing inward or collapsing to the side. It's just nice and in line. This is going to give you an arch. Your knee is going to be right over your ankle to start. Your hands again are pressing down. As you exhale, you're going to sit back, keeping that foot right where it's at. As you inhale, you're going to press forward. So this is actually going to give you exhale, you're going to sit back. Inhale forward, keep your head in line with your spine. Take about 3 more there, and you're going to start to notice maybe a little sensation through the front thigh. You're going to think, well, I thought we were stretching my back thigh. This is just starting to mobilize some of the stuff in your hip joint. Last one. Now, since we're on the side, we're going to now take the left shin, we're going to adjust it so that it's just in line with the left knee, and we're going to take your right foot in just a little bit more. Again, make sure your hips are level. I take my hands there sometimes to check. There's a tendency for this right hip to hike up. You're going to press your hands down. Now what I want you to do, so you're pressing your hands down. I'm going to move my chair forward a little bit. You're going to draw your front knee forward, and then press your back knee into the floor, and use the strength of that back knee to pull your hips back. So I'm going to relax, I'm just going to come forward, and I'm going to use the strength of that back knee to pull myself back. I'm going to take about 2 more there, and you might feel this in the right thigh, the right hip, or you might feel this in the left hip flexor. Depends on a few things. Both are right, there's no wrong. Now, I want you to keep tension on as you bring tension on that back leg as you bring yourself forward. And then press that left knee in to pull yourself back. And stay with this pattern. Taking about 2 more there. So you should feel activation, maybe, maybe not. in that back leg. Now, I'm gonna have you move the ball out of the way, or move the chair out of the way, sorry. You're gonna come onto your stomach. You're gonna rest your forehead on the floor, and you're gonna rest your pelvis into the floor. You're gonna bend your left knee, and I want you to see if you can keep the pelvis pressing evenly into the floor, so you don't lose contact. Just because you bent that left knee, you don't roll to the right hip. Keeping that contact, and this you're gonna see where I'm not very strong. You're going to try and lift that left thigh off the floor using your left glute. You're gonna hold here for 2 breaths, and then you're gonna lower down. And then you're gonna reset, making sure that pelvis is even, making sure the lowest ribs are dropped down. You're gonna lift that back knee. And lower. Taking 2 more there, lift. And lower. And lift. And lower. From here, you're gonna come on up. I'm just gonna continue with that left side since that's where we started. You might not get a very good view of me on this one, but I'll try to explain it as best as I can. I'm gonna take my chair, and feel free to take something underneath your left knee. So I'm taking my left knee, I'm bending it, and placing my left foot against the wall. Again, if you need to, place something underneath your left knee. You don't have to be on the floor like I am. You're gonna take your right foot forward, right? So we're in this lungy sort of position. My chair is right in front of me so that I can press my hands down. That's gonna help me seal my abs. Now I'm gonna press my back foot into the wall. I'm gonna stay here for 4 breaths. Keeping my eyes straight ahead. Once I finish my last exhale, I'm gonna inhale, I'm gonna try and bend my left knee a little bit and pull my left heel closer to my bottom, keeping my hands pressing down so that I don't arch my back. And then I'm gonna relax and just hold the stretch for about 4 more breaths. And then you're gonna repeat all of those on the other side. And just kind of notice how your hips feel after that. So again, what I did was I took you through something that mobilized your hip joint, again, just in this sagittal plane or this front to back plane. I did some things to activate the front of the hip, to activate the lateral thigh on the stationary hip, and then I also did some things to activate the back of the leg, because the thing that's gonna keep your hips from experiencing this tightness feeling is strength in your front of the body, but then also strength in the back of the body. So trying to maintain that and trying to regain some of that is gonna be your best bet for helping with this sensation of tightness. You can stretch as much as you want, but it'll probably only have a temporary effect unless you look a little bit deeper. And if you feel joint pain at all, don't do the exercises, and I would highly recommend seeing a chiropractor, a physical therapist, an orthopedic surgeon, someone to get assessed and to make sure that you don't have some sort of capsular restriction. All right, thank you so much for your time.